Okay, so talk a little bit about arthritis. What are the causes of arthritis out there? Well, I would say, again, arthritis and joint problems are a very common complaint for people with IBD. And not all joint pain relates to IBD, and this is important because people can get wear and tear of their joints that has nothing to do with inflammatory bowel disease. And again, these are very common human complaints. But IBD does increase your risk of inflammation in the joints. And we think about things in axia, which are things related to the spine, the center of the body. And there are a couple of conditions here. Sacroiliitis is probably the more common one. It's the joints that are in this picture that are between the bottom of the spine and the pelvic bone. They can be inflamed in some people with IBD, and that needs to be recognized because that needs to be treated. And there are the arthritis that affects the peripheral joints in the upper and lower limbs, and there are different subtypes of that as well. In many cases, treating the underlying inflammatory bowel disease will help the joints. So again, in many cases, the focus goes back to treating the Crohn's and colitis itself. So again, I think if you're struggling with arthritis, it's still important to engage your primary care provider because a lot of joint pain has nothing to do with the IBD. It's just the wear and tear kind of pain that many of us deal with. If it's problematic, we often involve other specialists like rheumatologists to see you and to evaluate you. Often treating the IBD itself will help. There are things that don't involve medications such as physiotherapy and exercise that may well be useful. An important note is to try to avoid, again, these NSAIDs like Motrin, Advil, naproxen, because they can make Crohn's or colitis worse. But there is a prescription drug in this family called Celebrex, which might be a little better tolerated and it's reasonably safe to use in people with Crohn's and colitis, but that would require a prescription in order to access it. Again, acetaminophen is fine. And there's an old-fashioned medication we sometimes take off the shelf called sulfasalazine that I don't think we have a lot of time for this, but just it's interesting. This has an interesting history because sulfasalazine was actually first used in the 1930s, so almost 100 years ago. But it was recognized that some people with arthritis also had colitis, and the colitis started to get better. And then a very smart person in the 70s figured out, well, sulfasalazine has two things in it, one of which is the 5-ASA that we talked about before, and it's actually the 5-ASA that's helping the colitis. And that discovery led to all those medications like Pentasa, Asacol, and Salifol, and Mesavant, which are used to treat colitis. So it's an interesting history of discovery and serendipity.